my name is Dr. Jennifer Burns. I'm the medical director for New Med Spa in Arizona. One of the things that we're offering and soon is going to be Dysport. Dysport is actually a botulinum toxin type A, similar to Botox. It's actually made from the company's Ipsen, but we're actually going to be selling it here in the United States. It has been sold in Europe, Australia, South America for about like 10 to 17 years. It was actually discovered first as a, to help with some muscular disorders, for like cervical dysplasia, which is actually where the muscles will start cramping up, causing people's necks and stuff like that to, to kind of like jerk in different directions. And so in injections in that area, they were able to relax those muscles, and then people were able to, like not have the jerkiness and stuff like that. Well, what happened with that is that they've actually found that it also worked on reducing wrinkles. And so from that aspect, then they started promoting it in Europe for wrinkle reduction. And it's been promoted in there as Dysport for like the last 12 years. There's very little side effects to it, so if any, which could be headache. Some people, for at least a couple of days just from the injection spots. Some people have reported a little bit of nausea from it just because from the injections. What happens is that the set-in time is about like 1 to 2 days, and it lasts for about like 4 to 6 months. So what it does is it actually helps to be able to relax the muscles, so then that way you're not getting that wrinkle formation. So it's like whenever you end up making like your angry face, then it doesn't show up that well. Dysport is also known as Relaxin. And so there's been a lot of studies out for Relaxin, like I said, the same thing as Dysport. And they found that what happens when people are injected with Dysport is that there's actually a 2% grade in the difference of people's wrinkle reduction. Now what we're talking about here is basically a 4% grading scale as far as when it goes for wrinkle reduction. So you're actually getting 50-55% noticeable difference with that as far as the with first application. And of course with like anything when it comes to either Dysport or Botox, the more it's injected, the more results people are going to see and the longer lasting it's going to be. So but it's the same thing, it even applies with Botox as well, with the headaches and also with the nausea that could possibly happen for like the next day until everything's setting in. It does take 2 weeks though for full effect with the Dysport. And then we have people come back in, and then we would go ahead and recheck them. Because sometimes there's like the muscle just still has just a little bit of movement to it, and isn't just as relaxed. And that's where we have people come back in, and then we just do a little bit of a touch up, and then we reschedule them for like 4 to 6 months later. There's a lot of plastic surgeons out in Europe and in like Central America. It's been sold in Brazil, Mexico, Germany, England, Australia, New Zealand, and so with that, it has a proven record. Dysport does. The nice thing is, the advantages to it compared to Botox is that the Dysport actually spreads a lot more. The spreadability of it. So for like bigger muscle areas, we don't have to use as much as we have to with Botox. And the other advantage to it too is that it sets in a lot quicker, and it also lasts a lot longer than Botox does. Yeah, so basically you don't have to do as many injection sites as you would with Botox because of the spreadability of it. So so it's really nice to have in like those bigger muscle areas. Well, when it comes to, like injection technique is basically going to be a little bit different with the Dysport than it is, like with Botox. So because because of the spreadability aspect of it, you don't have to use this, like the injection sites, you don't have to and do as many injections as you would, say the Botox would, like in the forehead. So, because of the spreadability, if you're having to do say like 15 pokes in the head on the forehead, you probably wouldn't have to do as many, with using the Dysport. Some people might ask, well, can Dysport actually be used for the crow's feet, for their forehead, for the underarms? And actually, yes, it can. Dysport can actually still be used in the crow's feet area, in the forehead, and they've actually shown really good results up to 48 weeks for underneath the underarms. And they're even doing it with palmar sweat as well. And they were noticing, according to research, like the effects it was having for palmar sweat too. The reason why people get injections in the underarms, whether it's for anybody, is because of excessive sweat. There's a lot of people who end up just by nature sweat a little bit more than everybody else does. So what it does is that it actually helps stop the sweat glands from producing a lot of sweat. And so then that way they can be, in the normal range. And then some people, just want to be able to minimize the sweat that they have because of like the climate that they live in, depending on certain like uniforms or shirts that they have to wear, and it makes it a lot more beneficial for them. And then it's like same thing with the hands. A lot of people got the nervous hands. So then, but here again, some people sweat a little bit more in that area than others, and then being able to just be able to control that. What happens is that they were able to minimize it, and so therefore they're are able to do normal activities and not have to worry about the sweat on the hand area. The FDA has basically approved Dysport for basically the glabellar, the 11s area. But it can still be according to research that has been done, it can be done in like the crow's feet and in the forehead, and then also in the underarms. A treatment session is about like 15-20 minutes, depending on like if it's we're having to do pictures and all that other stuff. So and then depending on how many areas they like to have injected. You can actually do all areas, say like crow's feet, 11s area, and the forehead in one session.
Okay.
So, and still again, here it doesn't matter which area it is. It's still going to take 2 weeks for it to set in. It would just be one session. It should be able to take care of it, and then they come in for their 2-week follow-up. Then if we need to do any touch-ups in the area, then that's what we do, and then we would reschedule them then for 4 to 6 months. And it will be available soon at New Med Spa.